Hello everyone and welcome to Drama DM, a place where propane takes so hot you could use them to make soup. Today, we're going to be talking about the link between medical gaslighting, chronic illness, and imposter syndrome.
I don't think you're using the right terminology. Imposter syndrome is usually referred to as the internal experience that you're not as competent as others perceive you to be.
I know, but in the context of
This is what happens when you go to Google for a diagnosis instead of your doctor.
I have gone to the doctor, multiple times in fact. I've been going to the doctor for years, but it was actually the internet that finally gave me a sense of which doctor I should go to. And I know I'm not the only one. More often than not, people with chronic conditions end up doing their own research so they can get their doctor's attention.
There you have it. Maybe I should refer you to psychiatry. Are you anxious? Depressed? Are you looking for validation? Maybe that's where your hypochondriac tendencies come from.
I'm not hypochondriac. I've got a chronic illness.
Did a YouTube video tell you that?
Actually, yeah, it was a video from Jessica Kilburn Fossard, but then a team of doctors confirmed it.
Are you sure you didn't fake your symptoms for attention? Or to get out of work? What is your job like? Maybe a couple of antidepressants will get you right back on your feet.
Look, I like my job. Please, read my file.
Hypermobile EDS. Yep, it's here. It doesn't really mean anything though. Hypermobile EDS is actually diagnosed by diagnosis criteria. You could still be faking. There's no real test that we can run to make sure you're telling the truth.
If you're not going to believe what I tell you, at least respect the opinions of your colleagues. I do have hEDS.
I suppose you're right. Okay, you already have a diagnosis. Why are you here?
First, I don't really enjoy coming to the hospital. So, if I'm asking for medical attention, I think it's fair to assume I need it. But don't worry, today I do have acute symptoms to show for it. I dislocated my shoulder, and it hurts.
It doesn't look dislocated to me. You can move it.
Yes, because I put it back in place. It still hurts though. And it's super unstable. Actually, most of my joints are.
It sure can't be all your joints. Where's the pain exactly?
Pretty much everywhere. But please, let's just focus on my shoulder for now. I shouldn't have said anything about the other stuff anyway.
Right. Well, I'll give you some ibuprofen. Take it when it hurts, okay?
I already have ibuprofen at home. Is there anything else we can do?
Well, if the problem really is that your joints are unstable, you should eat well and exercise. Maybe if you build some muscle, all your joints would stop dislocating.
Yeah, no, I can't really exercise on my own because whenever I do, I end up hurting myself. Could you maybe please give me some physical therapy? Maybe if they teach me which exercises to do and how to do them, I can both be safe and build some muscle.
I mean, if you insist, but you don't really have any acute symptoms now, do you?
I just told you I dislocated my shoulder.
Well, then I suppose I can give you physical therapy for your shoulder. Maybe a couple of sessions will do. Next available is in 7 months.
Okay, whatever. You know what? I can work with that. Could you please give me a couple of days of medical leave?
You already had a medical leave last month. Why this time?
Because I'm in a lot of pain and I dislocated my shoulder. And I work with children, which is not the best environment to heal from an injury. And I'm exhausted.
I've read your file. You didn't mention exhaustion before.
That's because I thought it was normal. I thought everyone got super tired and brain foggy when they did stuff. Besides, sometimes it's worse than others.
So, you're telling me you lived with this all your life and you just happened to never mention it?
Well, it's gotten worse lately, but in general terms, yes. Could you please stop looking at me like I'm lying? If I don't go to work, I don't get paid. And I need the money. I wouldn't ask for medical leave if I didn't need it.
I'm sorry. But you're trying to tell me that you've functioned perfectly well with these symptoms all your life. It's difficult to believe.
Check my file. I've never functioned perfectly well.
So, you've told me that you've got a job, a podcast, a YouTube channel, and are attending university.
Well, no one's actually attending university anymore, am I right? Sorry.
It just seems like an awful lot of things for someone so fatigued. You seem functional enough to live a normal life. I don't see the need for medical leave, I'm sorry.
I'm definitely not functional enough, though. What were we talking about? Imposter syndrome happening when others perceive you as more capable than you actually feel? Yeah, that's what I thought. Well, anyway, I still dislocated my shoulder. Can I get a couple of days of medical leave because of that?
My, but if you actually dislocated your shoulder, you would need a lot more to recover than a couple of days.
Yes, I know. But I can't afford that. I need the money.
Uh-huh. So you admit you can do the work.
Well, it's not like I have much of a choice, is it? So I'll work, and I'll try to be very careful, and I'll stuff myself with ibuprofen, and I'll probably be here in a couple of days with my arm hanging again.
You don't want the medical leave. Can't be that bad then.
You know what? Whatever.
Anything else you need?
I could do with some painkillers. Oh, and you've got to add an allergy to peaches to my file.
Another allergy.
Yes, and a really bothersome one. I like peaches.
And what happens when you eat a peach?
Well, my lips and tongue swell up and bleed.
Are you 100% sure it's the peach?
Yeah, I am.
Okay, I guess I'll add it. You may leave now.
What about the painkillers?
You told me you've got ibuprofen. Take that.
I do, but sometimes it barely does anything. Is there something stronger that I could take, or maybe something I could combine it with, like paracetamol?
For a sprained shoulder? No. Maybe you've developed a tolerance. Try taking less for a while.
I only take it when I really need to for that specific reason. Besides, it's not just the shoulder.
What else hurts?
Everything.
Well, I'll give you some paracetamol. Have a nice day. Send in the next patient. I'm already behind schedule.
If you feel like I've been talking in circles for a very long time, it's because I have. And you know what the worst thing is? I will go home, I will be very careful, I will take my ibuprofen, and I'll sprain my wrist trying to open a vinegar bottle. And I want to go to the doctor. Because even if what I've just told you doesn't sound too bad, after years and years of medical gaslighting, sometimes I actually rather be in pain than going to the ER. And I am aware, as lots of people are aware, that there are parts of our conditions that we're just gonna have to live with. And I can accept that. However, I'm also aware that there are other parts that can get better if you follow the right steps. I've been meaning to call a private physiotherapist for weeks. But the last time I went, they decided I was faking because it was not possible that I had sprained yet another thing. And basically they just stopped treating me. So every time I think about calling, I panic. I even ask myself if I'm faking for attention when I'm home alone and I haven't even told anyone about my fun new symptom yet. And the thing is, yes, I do want attention. I want to feel validated in a pain that's pretty much invisible most of the time. That doesn't mean that I'm faking it, and it doesn't mean that it's all I talk about. And no, I'm not trying to victimize myself. I really don't want pity, I don't want sad glances, and I don't want people babying me. All I want is for us to have a couple of laughs at my expense and to remind you all that if you are sick, then you're sick. And you've got every right to ask for help. And if you're not, but you've got someone in your life that's not having the best of times for whatever reason, just try to be extra kind. Finally, I'd like to add a huge disclaimer. There are people in the medical field that are amazing professionals and a great help. For example, my current rheumatologist has gone way out of his way to make my life easier. The problem is that it took me 22 years to get to him. And even if I'm super thankful for the healthcare in my country, I am also aware of the lack of resources and the amount of hours that these people work, especially now. Still, there's no denying that medical gaslighting and medical related trauma are a thing. Sadly, my experience is not at all uncommon, like it happens to a lot of people. I hope you've enjoyed this video. Please give me a big thumbs up and share this with someone you think might need to hear it. I'm thinking about making a little series about the medical system, so please let me know in the comments if that's something you would be interested in. You can find me on Twitter at ATMDrum. You can find me on Instagram and Reddit as the DramaTM, and you can drop by my Patreon if that's something you'd like to do at patreon.com/DramaTM. Love you all. Bye!